Welcome to Invest Insights. I'm Abby Malone. I'm joined today by Michael Lawton, the CEO for Community and State Healthcare Plans of Florida for UnitedHealthcare. He joins us for our discussion on the COVID-19 pandemic. Please don't forget to like this video and subscribe to our channel for more information. Michael, since the advent of COVID-19 pandemic, UnitedHealthcare has provided more than $70 million directly to the global community. Tell us how that translates to the support for Florida.
Great, Abby. Thank you very much for this opportunity. UnitedHealth Group's commitment focuses on supporting those most directly affected by the pandemic, including our healthcare workers, hard-hit states, seniors, and people experiencing food insecurity and homelessness. In Florida, we saw an urgent need to provide assistance to residents experiencing unprecedented hardships during the COVID pandemic, especially those who faced the homelessness and food insecurity that I mentioned. To this end, UnitedHealthcare Foundation was proud to commit $1 million to Feeding Florida and the Coalition for the Homeless of Central Florida. We provided $500,000 to Feeding Florida, which works with farmers and restaurants across the state to harvest and prepare and distribute healthy foods to those most in need. Really important programs. In addition, the foods are being used to support food-based meal programs, school-based meal programs, replenish food banks, which is always needed. I would ask everybody to think about your food bank and get out there and make a donation, and partner with the Florida Department of Elder Affairs to distribute food to seniors. We also provided $500,000 to the Coalition for the Homeless of Central Florida so that they could create spaces that would help isolate people who were maybe COVID positive or had symptoms of COVID, which is very important. Clearly, the Coalition for Homelessness takes on a very important role in trying to eliminate homelessness and find homes for people. So to be able to help them and identify places where they can go and help them redistribute their spaces is very important to us. We've worked with the YMCA, with the Larry T. McRae Dream Builders Foundation, supporting them with $10,000 so that they can distribute food around several Ys. And then just recently, as the Governor DeSantis pointed out, we started last week, we partnered with the Department of Family and Children's to redeploy 100 UnitedHealthcare call center representatives to answer client calls to assist them with getting supplemental nutritional assistance or SNAP and temporary assistance for needy families or Medicaid eligibility. We do this primarily because we want to support our state and we want to be a good steward for the state.
Well, you've been busy indeed, and technology, I'm sure, has been playing a part on all sides. Can you talk to me a bit about how you've harnessed technology to help the broader services for your members?
Yeah, so appreciate that. We've expanded our telehealth services pretty significantly, making it possible for people to connect with their personal providers or to our national provider partners throughout our virtual visit programs. We have many. UnitedHealthcare, we believe everybody should have access to health information and care anywhere and anytime. It's our job to help people more easily navigate the healthcare system and take charge of their health. Our mission is to help people live healthier lives. Telehealth empowers people to connect really around the clock with a healthcare provider with a smartphone, a tablet, personal computer, wherever you can. We've got services that are audio only, and we've got audio and visual services. So telehealth can help serve as a first-line option for people who may think they have COVID or have symptoms of COVID or experiencing some of those challenges. So we encourage people to use the technology. To that end, we've waived a lot of member cost share for our commercial plans through the middle of June. And we're really encouraging people to use that as a first-line event to help take care of those needs, as well as not just their physical needs, but their behavioral health needs and some of their occupational and speech therapy needs as well.
What other digital resources is UnitedHealthcare offering to help members with their health?
Yeah, so I appreciate that. One of the exciting things that we've done, and if you're a UnitedHealthcare member or just want to go out and visit the UnitedHealthcare website, uhc.com, you can go out. We've got a program that basically is a symptom check. So we've deployed triage tools, including a symptom checker with the best available recommendations for the highest risk members. The tool provides the most up-to-date information about prevention, coverage, support needed to rapidly assess the symptoms. You can schedule a telehealth visit right there from it. You can talk with a nurse. If you have a UnitedHealthcare program, you can refill or schedule a home delivery for prescriptions and access to emotional support if you need some behavioral health or emotional support 24 hours a day. this whole event is causing everybody a lot of challenges, right? So we're all, as you can see, I'm shut in my house. I'm here in my home office. But we all have stressors, and they're compounded by the COVID time. So we invite people who need it to seek emotional support from visiting Sanvella Health, the UnitedHealthcare group. No additional charge through our mental health mobile app or through the 24/7 emotional support lines. It's an effort to help all Americans with mental health impacts during COVID-19.
What can healthcare providers expect to see in reimbursement practices during the pandemic cycle?
So I think the short-term pressures that have been caused, that are put on the provider systems, are really what we're most concerned about. We've heard a lot of stories about hospitals being overwhelmed with COVID patients, but at the same time, they've had to reduce a lot of other services that they've done, a lot of elective surgeries, therapies, and whatnot. So it's important for us to make sure that we're supporting our provider community because we need them. We partner with them to provide services to everybody. To address that, some of the short-term pressures, the UnitedHealth Group has taken a step to accelerate $2 billion in payments to our clients. So we've taken everything and just tried to accelerate that through our system to make sure we get that money out to the doctors and hospitals and providers as quickly as possible. To help reduce administrative burdens for hospitals and physicians and other facilities, we've to ensure the care people need, we've reduced our prior authorization requirements. We'll reimburse all eligible in-network patients who communicate with their doctor using telehealth, as I mentioned before. And we've increased our capacity for the providers, allowing them to remain safe. So I think all those things taken together, what we're trying to do is we're really trying to make sure that dollars get out to where they need, patients and members continue to get the care that they need, and that we provide new access points for them through telehealth services. All those things together should see some reimbursement and some pressures taken off the healthcare system.
Much needed indeed. The tests are on everyone's mind, and I know that you've developed and tested a new self-administered COVID-19 swab protocol that has now been approved by the FDA. Walk us through getting that approved, and what does that mean for the public at large?
Yeah, so thankfully I'm not a scientist, business person, but UnitedHealthcare, your UnitedHealth Group is really proud to say that we've been involved with this process of trying to impact COVID-19 for a long time. Really, when the first cases started showing up in Washington, we have practices that are out in Everett, Washington. They began partnering with the federal government and state government to identify new and innovative techniques for identifying COVID. One of the things that they did was they started with a swab technique. That swab technique, the original test required a nasal swab to go very, very deep in the nasal cavity or down in the throat to get the required sample. We were able to do a test and actually show that they could do that with a shorter swab so that it would be more comfortable for people and more people would be able to get the service. So that was one of the things that we worked on very quickly. Now, UnitedHealth Group's developed and tested a new self-administered COVID-19 swab protocol that's now FDA approved. And so that'll get widespread adoption and is a very less invasive test. So we're very, very pleased to be part of that. And we continually look for new innovations to drive this COVID situation down. We're working with all of our pharmaceutical partners to help them as well.
Good. And should our viewers want to find out more up-to-date information, where would you guide them?
I would send them to UnitedHealthcare's website, uhc.com, and welcome anybody to go out there and take a look at the information that's available to them. And if they're a UnitedHealthcare member, look for that number on the back of your card. If you have any questions, please feel free to call our call centers. Use the website. We want to make sure that we get as much information to you as possible. Again, our mission is to help you live a healthier life. Thank you.
Excellent. Well, thank you so much. That was Michael Lawton, the CEO for Community and State Healthcare Plans of Florida for UnitedHealthcare. Please, again, don't forget to like this video and subscribe to our channel to watch more insights like these. My name is Abby Malone, and you've been watching Invest Insights. Thank you.